Hi, my name is Pedro Flores. I am a psychology undergrad student, and I'm here to talk a little bit about my research, the cognitive sequelae in long COVID, 1 year follow-up assessment post-infection. This research was made with the help and supervision of Professor Raphael Chrytopher Borguezan. So without further ado, let's give you some introductions. And first things first, the long COVID emerges as a growing public health concern resulting from the COVID-19 pandemic and is characterized by persistent health impairments that endure for months post-infection. And if we look at the brain, what you're going to notice that we have cognitive impairments that encompasses both memory, language, attention, executive functions, and also psychomotor skills. So understanding the intricacies of the virus impact on the nervous system can aid us in constructing a clinical profile on long COVID and enabling early symptoms identifications, also contributing to the development of individualized intervention plans. So our objectives in this research was to establish an evolving cognitive profile on patients 1 year after SARS-CoV-2 infection. And this is how we did it. We conducted a quantitative study with an observational design in which patients assessed in 2021 were invited for a follow-up evaluation in 2022. Participants underwent assessment using a standardized neuropsychology battery and were compared to their own previous performance using a statistical analysis conducted through IBM SPSS version 24. Our neuropsychology assessment battery was composed by the following psychometric instruments, and now that we know our objectives and how we look for the data, let's analyze what we find. First things first, our sample was consisted of 11 participants, 6 females, 5 males, with an average age of 52 years. And all the patients were hospitalized due to COVID-19 infection, in which 81.8% of them required admission in the ICU for an average length of stay of 6.4 days. And the data shows that we had a significant improvement in participants' retention and retrieval of information. We found associations between recovery of short and long-term verbal memory and higher levels of education. We also find that the participants over 51 years old of age showed better results in short and long-term visual memory compared to their initial assessments. So there was significant improvement in cognitive flexibility that was associated with higher education. And when we look at this data, we also see that we found no significant changes identified in both language, attention, and visual function, with remaining significantly affected 1 year after the first assessment. So, in other words, we found indeed long COVID cases in our patients. And if we're gonna try to understand what the data shows is that we did have improvements in memory and executive functions associated with both age, education, and length of stays in the ICU. Now, this is important because identifying protective factors can aid us to develop in the prognostic tools and prevention and treatment strategies to better understand how we can help people that have COVID and now have long COVID syndrome. We also did, like I said, identify persistent alterations in language, attention, and visual functions, which confirms the presence of long COVID within our samples. This finds it's in line with international studies and emphasize the need for further research with the Brazilian population involving our larger sample so we can generalize our results. And if you're interested in reading a little bit more about that, I'll leave you my references. In the QR code, you can find all the references we use in the study. And without further ado, I'd like to thank you so much for listening.